Radical approach for producing medical breakthroughs. A new documentary shows how DARPA can change lives for patients. Take a look.
We can't just hide our heads in the sand and say, no,
it's not working. We need a new approach.
If you want someone to do something revolutionary, you have to create a revolutionary apparatus for it.
Our guests this morning are the men behind the film and the DARPA program. Joining me right now is the former vice chairman of General Electric, former NBC chairman, Suzanne Wright Foundation chairman, and Autism Speaks co-founder Bob Wright is here, along with the founder and former director of DARPA's Biotech office, Dr. Geoffrey Ling. Good to see you. Thanks so much for joining us, both of you.
Thank you for having us.
Yeah, I'm looking forward to hosting a panel discussion over the film's premiere, Bob, with you tomorrow night. Tell us about the story behind this documentary.
Well, it tries to put into perspective what we're doing and the needs. This advanced research projects agency exists in the government at 3 or 4 different levels in different parts of it, and it allows breakthroughs in science or medicine or engineering to take place in a very unregulated but extremely strong environment. And DARPA, which is where Dr. Ling spent so much time, is the model, and it's been 1960. It's from 1958. President Eisenhower formed it. So this should happen. We should have DARPA, which is Health Advanced Research Projects Agency, inside of Health and Human Services, reporting to the Secretary and the President. That's how these things work. Mm-hmm. And they get allocated money from Congress, and they use big bites. They take on big projects, and they do it on a very tight time schedule.
Like what kind of projects, Dr. Ling? Tell us more about it.
So there are many projects that we can actually start to use this DARPA model on. You think across the spectra of human diseases, it's almost limitless, Maria. You can start with cancer, you can look at autism, you can look at Alzheimer's disease. There's a whole host of these kind of disorders that we can actually do this targeted, very intense, and as Bob said, large bite projects for. And again, this is not a new idea. DARPA has done it for defense reasons. The intelligence agencies have done it with IARPA. The Department of Energy has done it with theirs. And, of course, even HHS. BARDA has just recently started one in the narrow confines of their very important mission space of making sure they take care of critical health calamities, such as, like an epidemic outbreak. But what about the other serious diseases that we all face? I just said cardiovascular diseases, cancer, Alzheimer's disease, neurodegenerative disorders, autism. These are very important disorders for which a DARPA-like model could really help in a major breakthrough to get to patients as soon as we possibly can get there.
What are the barriers now? The government spends tens of billions of dollars a year on research. Pharma spends tens of billions of dollars. What are you doing that is not being done? What are the barriers that you're overcoming now?
Well, really, it is a barrier of culture. Barrier of culture. There is no law that prevents this. There's really no philosophical reason to prevent this, Mr. Forbes. It really comes down to a will just to do it. As I said before, 3 other agencies that Bob had just talked about, in addition to the Department of Defense, have already started it, and we can do this. So it's really a philosophical change. The critical word is philosophical. The concept that you can actually use milestone-driven, timeline-driven research to come up with breakthroughs that pertain to health would, in fact, be new for the government.
So why hasn't pharma done this before?
There's still a high risk, sir. When you talk about things like new disease, new drugs, new devices, even new ways of doing things, there's a very strong regulatory environment that you still have to overcome, which is totally reasonable, but it provides a certain level of risk that makes it very difficult for the markets to bear.
Sort of a medical skunk works?
It is, in fact, it is. I think that's a good way to think about it.
Well, it's interesting because I feel like ever since we mapped the genome, we really started understanding the body and disease much better. We changed our behavior in terms of smoking, knowing that it causes cancer. We changed our behavior in terms of eating, knowing the risks of heart disease. We haven't had the kind of knowledge to make changes with regard to the brain. So you talk about autism, Alzheimer's. What can you do in this program to really move the needle on that?
Well, I think you really hit the nail on the head when you said, look at the things that we're doing for our lifespan and our heart.
Right.
We did a remarkable study in the late 1940s. It took a long time for this to churn its way through, but we all know now that everybody knows what blood pressure is a high blood pressure.
Well, that's what I'm saying.
Yeah, we need to do the same thing.
But we don't know about Alzheimer's. We don't know about the brain.
Exactly. We need to do that. Why hasn't it been done? You might ask.
It's your question.
Well, and in terms of, say, cancers like glioblastoma, which Senator John McCain has, which killed one of my family members, you don't have the kind of money and research power being poured into these areas as you do other cancers, because there's not the money there, because you have such a small instance. Although it is an incredibly deadly cancer, you have a fairly small instance of its occurrence in people every year. So you don't have, you have good research, but you don't have the best research and the vast amounts of money targeted at it. So this is the kind of thing that you're
everything
talking about.
isn't as hard as Alzheimer's. Since my wife died, which is a little less than 2 years, since she died, 92,000 people have died of pancreatic cancer. And for 85% of the people that are diagnosed each year, which is 55,000, 75% of them will die in the first year.
Right.
And they're dying like clockwork. So I feel like I've got the clock on me. Every day, during this particular newscast, we'll lose 2 or 3 people. We'll lose 123 today.
Right.
And it happens every single day. Now, early detection is totally lacking. That would be the first thing we would try to start on. Early detection is got more. That's where you bring engineering in, you bring radiology in, you bring MDs in, PhDs. See, those things don't happen inside of the government, and they don't happen outside of the government because they're a risky kind of a project, and say, well, let's take something that we're already in. That could be like the very first
private
project.
investment, right?
No, this would be government.
With government.
Yeah, you want it because you want access to all the government's data. Okay. You want them to be cooperative. You want to get data from CDC. You want to get data from the NIH. You want all of that's very important.
So let's say you make a breakthrough. What about FDA? Are you able to get over?
Well, FDA would be part of it. You would bring FDA into it.
That's one of the huge parts of the expense of the $2.6 billion to bring a new drug to market. Can you speed that up?
Sir, you're creating a new ecosystem, and very importantly, this ecosystem is based upon accountability. So as you invest money into an DARPA-like project, there is accountability. That's the very difference.
That is a big difference. Look, obviously, we are all rooting for you. We want to see you have success here. So thank you very much for that.
Thank you.